Good afternoon. It's indeed a great pleasure to be with you. Thank you for the kind invitation to join me in this very important summit. I believe it's more important than ever understand the priorities of citizens. I want to congratulate you for your initiative of trying to understand the global public opinion, and I was also challenged to tell you about my priorities. I've been very fortunate in life. I've been an academic career. I was also a politician, serving my country, Portugal, in different positions, including Prime Minister, and afterwards serving as President of the European Commission for 2 terms, between 2004 and 2014. And after I left politics, as I say, after I left politics, my level of sincerity is increasing day by day. I have the opportunity to speak about many issues globally. I share some boards, including on finance and also on a pro bono way, the Gavi, the Global Alliance. And so when you ask me today what is my priority, I think first of all there is a global priority that we should all have is peace. Yesterday it was International Peace Day. Personally, I'll never forget the opportunity that was to receive on behalf of the European Union the Nobel Peace Prize in 2012. Without peace, nothing else can be delivered. And we should not forget this at this very critical moment we are now living globally. But afterwards, of course, we have priorities that we are specifically working in. And from that point of view, my priority today is health for all. And I'm very proud of serving Gavi, the Vaccine Alliance. Since it was founded in 2000, Gavi has helped vaccinate nearly 1 billion children in 77 countries through routine immunization, and Gavi has supported more than 1.2 billion vaccinations. Because of all this, it has prevented more than 15 million future deaths. By preventing illness, death, and long-term disability, Gavi-supported vaccines helped generate more than $230 billion in economic benefits from 2000 to 2020. This was what Gavi, the Vaccine Alliance, was working on with partners to increase the uptake and scale of vaccines and strengthen health systems in order to reach every child, especially what we call the zero-dose children, those who miss out on receiving even a single dose of a basic vaccine. Today we have 12.5 million zero-dose children in the world. But then the COVID struck, and it has done it without any discrimination for high-income or low-income countries and economies, rich or poor, north or south. This triggered global leaders to call for a solution that would accelerate the development and manufacture of COVID-19 vaccines, as well as diagnostics and treatments, and guarantee rapid, fair, equitable access to them for all countries. Can you hear me? Yes. The result of an extraordinary and unique global cooperation. COVAX has the world's largest and most portfolio of COVID-19 vaccines, and this represents the world's best hope of bringing the acute phase of this pandemic to a swift end. As we speak, the COVAX facility has delivered over 1.7 billion doses to 146 countries, with 1.5 billion of this, around 90%, going to lower-income countries that would otherwise have struggled to get access. COVID-19 may have been the biggest global health crisis in a century, but in so many ways it could have been even worse, much worse. Despite the scale and suffering, with the pandemic not yet over and at least 15 million people dead, these are the official statistics, nearly 600 million people infected, now possibly more than the so-called Spanish flu, at a cost to the global economy of at least $11 trillion and counting, it could be even worse. Had the virus been more transmissible, more virulent, or more lethal, the state of the world today would likely be even bleaker. Given that the risk of another pandemic occurring with the same kind of impact as COVID-19 is, according to some studies, increasing by 2% with each year, that threat still hangs over us. So are we now any better prepared for the next pandemic? Despite facing immense barriers every step of the way, COVAX is the main reason why 75% of healthcare workers and 63% of older people in low-income countries are now fully protected, as are on average 50% of their populations. So if we are to stand a chance of being prepared for the next pandemic, because it's sure we are going to have a next pandemic, then it makes sense to have something like COVAX already in place and funded in advance before the crisis strikes, to ensure that next time the response is faster and more effective. Yet, currently there are no plans for this. There is some work going on in the UN, in WHO, in the G20. I'm following some of this work, but let me be very frank with you, that's the advantage of being a former politician. The reality is that today, the level of cooperation in the international organizations, including in multilateral settings, is lower than before. I remember, for instance, participating in many G20 summits. And in spite of all the difference, the United States, China, European Union, Russia, Saudi Arabia, part of the G20, Indonesia, etc., we were cooperating. Today, I have to say that very frankly to you, I fear that because of the very serious global frictions, we may be at risk when it comes to these global public goods, like public health. Public health is typically a global public good because the virus does not need a visa to travel. The virus goes everywhere, does not ask permission, cross borders. So for these global public goods, like public health, like fight against climate change and others, we really need, and that's a message we should send to our political leaders, we need that they, for some time, they put politics aside. I'm not naive, they will never put completely politics aside. And geopolitical frictions, unfortunately, will increase. That's, I think, almost sure. But to keep some of these issues with a space of cooperation. And that's one of the areas where I think initiatives like this one, the Priority Summit, can be very, very important. And that's the message I'd like to give you now, that we should build on the experience of this COVID-19. It was so traumatic to do something for a better world. And to do it for tomorrow, we have to start now. Thank you very much for your kind attention.